morning, clinic family. It's January 15th, 2021. We're about 9 months into this COVID year. It's crossed over into the new year. We first had a fireside chat with you all back in March of 2020. I hope this is one of the last conversations we'll broadcast about this particular virus. I think we've come through the worst of it, I hope, and so I want to talk to you today about some questions that we are receiving from many of our members, and hope that by sharing this conversation with many of you, we can answer many of the questions that may be on your mind. So, those questions are, of course, about the vaccination. Questions include, should I get the vaccine? Would I get the vaccine? Who should not get the vaccine? All those sorts of questions. So, and I would say all of my patients who know me know that I am not eager to put an industrial product in my body, a pharmaceutical or other chemicals, if by proper nourishment and care of my own body, I can prevent the need for those things. So I imagine many of my patients wonder, well, would I get it? And the answer, I would assure you, is that I did get it. And I did get it, as are all frontline healthcare workers encouraged to get it, on the hope, though not proven, that by my getting it, I reduce the risk of spreading it to you, my patients. So I've had it, and my arm's a little sore today. I had my second dose on Wednesday, but so far so good. And so my personal experience has been uneventful, and data from the studies has also shown a very low incidence of serious adverse events. So I do think that you should get the vaccine. There are a few known reasons why you should not, the main ones being a history of anaphylactic reaction to a previous vaccine. So if that's you, and anaphylaxis is not just, I felt bad or I felt like I had the flu. Anaphylaxis is a life-threatening severe illness that requires hospitalization or at least emergency room care. So if you've had that, you ought to think twice, and we should talk about it. If you are on immune suppressing medications, such as you have an autoimmune illness or you're being treated with chemotherapy for cancer, those are reasons why your immune system may not respond as well to the vaccine, and you may not have as good an immune response to the vaccine. So for some of our patients, we're having them hold their immune suppressing medications for a period of time to allow them to have an adequate response. Those are not reasons why you cannot have the vaccine. So for most of you, the broadcast message is it is a safe and proven effective vaccine, and myself and my partner, Dr. Lipinski, have gotten it. So we urge you to go ahead. And then the next question is, where should I get it and when should I get it? And in this, I would tell you, my partner and I have made it our, have created our whole clinic, and our deepest convictions about the way we practice medicine are based on preserving the sanctity of the doctor-patient relationship, and that caring for people as doctors requires us to know our patients as individuals, and we seek not to treat people as a homogeneous statistical entity, but to know each of you well and know your individual features which make treating you different for each one of you. That's how I feel about my role as your personal physician. What we're dealing with now is a different circumstance. What we're dealing with is something that is a broadcast intervention for the whole population. And in that sense, this is not really, I speak to you not as your personal physician, but as your spokesperson for health and for public health, with which I'm tangentially related. That's not the main thrust of my work, but in this case, I'm speaking in that capacity. So this is a broadcast measure for the whole population that I as an individual am not going to be able to deliver, just like I can't build a interstate highway system. This is a proper role for the state. So to the extent that I can contribute to the orderly and fair and equitable distribution of this vaccine for all people, I would like to do that. And if I can do that specifically for our clinic family, make it orderly and fair and not overly onerous, that's certainly my desire to do that. My wife, Liz, the practice manager, has been burning up the internet and the phone lines trying to figure out how to help all of you, our clinic members, to get this in a way that is fair and equitable, not just for our population, but for the whole country. So I urge patience for all of us, all of you, all of us as a country, that we would put the interests of others ahead of our own, and know that all efforts are being made both by this clinic and by larger public health entities to distribute this as quickly and effectively as we can. It's a difficult project. Obviously, there are a lot of Americans, and so just urge patience. It's brand new, and we'll get through this. I will say that I got the vaccine principally out of a desire to protect my patients from my potential spread. Again, though that's not totally proven that that's the case. The other measures that prevent spread of this illness are absolutely effective. So, it is not waiting in desperation for this vaccine. There are the other proven ways of preventing spread of this illness: wearing the mask, keeping some distance from other folks, and maintaining good health in general by eating well and exercising and doing all the things that keep us well are still well demonstrated to prevent the virus. So keep doing those things, and let's all wait our turn. Let's see. Practice manager, is there any other question that I need to address? No.
Just, we will continue to put on our website or send out if we have information about where you can get the vaccine.
Right.
So
yes.
That's the best place to look is our website. I mean, you can look on the state and other things, but if there's anything that we know, we're going to put it on our website as quickly as possible.
Right. And when we have a significant information to distribute, we'll send that out via email. But if you're just wondering in between emails, go to fischerclinic.com, and we'll keep updates there. Great. Well, thank you. Nice to be with you this morning, and I hope you all stay away from this virus and stay healthy. Take care.